Is that the midwife bag?
It is the midwife bag. This is the prenatal bag. There's a whole suitcase for birth.
Oh wow, that's a big suitcase.
Yeah. So there's oxygen in the back. That goes with this. And then this just has sterile stuff. Sterile stuff for birth, sutures, oxygen, blood pressure cup, Doppler.
So everything you need for a baby,
Right
you
there.
have in the back of your car.
Like if you had your baby right this minute, we wouldn't have to leave this
We'd be
place.
straight.
Yeah,
We'd be good.
We'd be good.
The thing that made me say I'll never ever have a baby in a hospital was actually my doctor was suturing and my legs were in stirrups and two guys come in and they're talking to her about golf and what they're gonna do for the weekend, and I thought, like, this is really personal to me. Even though you see this every day, it felt just wrong and I felt disrespected.
There was a time in America when most births took place outside of hospitals. Yeah. What happened?
Money. Birth is a big business and there's a lot of money to be made. What makes hospital birth cost effective is you being hooked up to a monitor. Several patients can be hooked to a monitor. A nurse can watch from outside all those patients and see that the mom's vitals are good, baby's vitals are good, which is really important in birth. It's very high tech, but there's no one there to support you. There's no one there to tell you you're okay. There's no one there to say your body is doing what it's supposed to. Just the beep of a machine.
We use very high-priced personnel and our hospitals cost more. We do tests, we do labs, we do lots of work. And all over the world there are midwives and nurse practitioners and others who are successfully and healthily delivering babies. With some deliveries, the presence of midwives actually is a real benefit, and yet that is a practice that is discouraged in a lot of places around the country.
In 1900, almost all births in the U.S. happened at home. 70 years later, only 1% of births happened outside of hospitals. Today, that number is still small, but in less than a decade, the percentage of births happening at home or in birth centers jumped nearly 60%. At the same time, the number of certified professional midwives has grown exponentially. They work predominantly outside of hospitals, but can only practice legally in about half of the country. Even in the states where they are legally recognized, your health insurance still may not cover this type of midwife.
She's doing really good.
Are you on call to these women 24/7?
I am.
So they can call you anytime if they have questions or concerns?
Absolutely.
You might go over there.
Especially for new parents, the baby has been crying, like what could that be? Like it's just really reassurance to trust what they were gonna do anyway.
So where are we going, Debbie?
We're going to visit Claudia, and she's 6, this is our last appointment. She's 6 weeks postpartum. She's super laid back, really, really easy client.
Did you have your babies in this room here?
No.
No.
She was born in my bathroom.
In the bathtub?
In the bathtub.
And her sister was born at the birth center.
I just didn't see myself giving birth at a hospital with people I didn't know. It was very impersonal. Deep down, I always knew that wasn't really healing. Yeah, it was very... I'm sorry. Sorry. You don't like that memory either, huh? Yeah, it was like 3 minutes, 5 minutes maybe, visits with my doctor. And I felt like he was very uncomfortable too, because I was just like, I think probably he didn't see a lot of women who were that confident in their bodies.
Claudia's insurance would have covered visits with an OB and a hospital birth. She's paying for Debbie's services out of pocket.
Because my family gave me a lot of shit about it at first.
Really? Your family didn't want you to use a midwife?
No, because there's a class issue that's associated with that, because people who can't afford to go to hospitals in our countries, it's because you're poor. That's the negative connotation, that having babies at home is because you're poor.
Yeah, your parents are probably like, if you can
Why-
afford to be in a
yeah.
hospital, if you
We
have
fought
insurance,
hard
why
to be
would
able
you?
to,
Yeah.
exactly, to be able to be in hospitals and get treated by doctors. So to say like, actually, I'm gonna just do it at home feels weird for some people, just backwards.
There's a lot of fear around that too, because I think people have bad experience because of the poverty level there. You have an emergency situation, you can't access a hospital. Absolutely, that's really scary.
The American Congress of Obstetricians and Gynecologists recommends that hospitals and birth centers are the safest places to give birth, citing the higher risk of neonatal death associated with home births. But the problem is, data on planned home birth is extremely limited.
You know, it's a huge responsibility to walk into someone's house and say, I'm going to keep you safe without an operating room down the hallway. So you have to take that seriously.
So who should definitively have a hospital birth?
Any woman with a pre-existing condition that would put them at in a high-risk category. We only take women that are low risk and healthy. Home birth isn't the goal. Safe, healthy mom and baby is the goal. So if it's safer for you to be somewhere else, we don't. It's not home birth or bust.
She's 8'6". Good job.
Oh, maybe she won't poke her feet out. Can you poke your feet out? It's really cute when you poke your feet out. Oh, pretty good. She's 6'5" today.
Ooh, good girl.
Yeah, that's great. I think that everything that is problematic in this country comes from that, that trio of, is it racism, is it sexism, is it classism?
Valerie Sasson owns her own birth center in Puget Sound, Washington, and has been pushing policy reforms to increase access to midwifery care outside of hospitals for the past 2 decades.
Turn right onto I-405.
I'm extremely interested in birth as a possibility for empowerment and justice. Herein lies the absolute failure of modern midwifery. White midwifery has been thriving. So we have the opportunity in Washington, which is not true across the nation, to offer midwifery services in all settings. Birth center-based midwifery, home birth midwifery. Hey, you guys! Washington State is absolutely a model for the other 49 states.
The rate of out-of-hospital births here is nearly 3 times the national average. Because the bulk of maternity care spending comes from the hospital facility fees, giving birth outside of the hospital is significantly cheaper. And an independent study estimated that certified professional midwives saved the Washington healthcare system $2.7 million in 2 years in avoided C-sections alone.
C-sections increase the rate of C-sections. Then you're creating a system where intervention begets intervention. So we have this fear that now triggers that fear, and every one of those fears becomes more and more expensive. That's the opposite of midwifery care.
But what about in the parts of the country where insurance doesn't cover these midwives?
That's the whole crisis right now. We're not reimbursed across the country. If you wanted a midwife, you had to have a home birth, and you had to pay cash, which really limits people's access just tremendously. You need to be concerned about healthcare spending. We need to promote midwifery. It is the solution. Intimate care is the solution for human beings. Oh my gosh, you're having a contraction right this second. We're not going to solve it by making ever bigger systems that are depersonalized. We're going to solve it by training midwives from each community to serve within their community.
There are way too many women who don't get adequate prenatal care from the very beginning. So they may end up in much more difficult situations as that pregnancy goes along. I think it's a horrifying data point for this country, the richest country on the face of the earth, that we still have totally preventable maternal deaths occurring each and every day in the United States, and people aren't outraged.
And the racial disparities are astonishing. Babies born to African American moms are twice as likely to die as infants than white babies. And African American women are over 3 times more likely to die from pregnancy complications than white women.
How can you turn your back on a major issue like infant and maternal mortality rates in the African American community? As a Black woman it just doesn't feel right to me not to do something about that.
How you doing? She's full. What's up?
I think quality maternity care is going to change that. But you can't get good quality maternity care in 5 minutes, and you're waiting in an office for 2 hours for an appointment.
Once I had a doctor tell me, well, we can touch on that next appointment because we only have 15 minutes.
And you had already done your 15 minutes?
My 15 minutes was up, basically like, okay, well, the nurse is gonna see you now. I'm having a baby for the first time. I still obviously had concerns, and they weren't, really assisting me.
The experience that you had, like, I think a lot of, especially African American women, have that experience where you just feel like you don't feel empowered at all when you walk out of the doctor's office. You feel like something's wrong. I have women call me every day talking about they can't get care because the wait is 4 months. So you have 4 to 6 months before you can even see someone because their options are limited, who takes their insurance and who will take Medi-Cal.
All right, let's take a listen.
A lot of my clientele, they don't have a lot of money, so I do a lot of discounted births. Those are the people I want to serve.
So you make a lot less than you could because
Absolutely.
you're wanting to service a certain kind of clients.
Absolutely. I mean, I do it because it's necessary, and I think it's really important for people to see someone who looks like them. That's really why I do it.
Hi, baby. It's perfect. Sounds great.